Next pathology. No, yes. Then there is a thing known as tolerance. You start drinking alcohol. First of all, doesn't taste good, but the second day, one drink will give you pleasure. You'll feel very, very happy about it. Maybe your cognitive function may also improve. But the neurotransmitters get depleted and you ask for more. Instead of one drink, you ask for 2 drinks, subsequently you ask for 4 drinks. Even 4 drinks gives you only that amount of pleasure which initially was given by 1 drink. So this is known as development of tolerance. Development of tolerance leads to, you could say, the pleasure will become weak. The pleasure becomes weak, not only weak, but it becomes shorter also. The pain, because that dopamine is not there, because you are not getting that drinks or you have stopped drinking this thing, the pain becomes more. Pain becomes stronger and pain becomes longer. So this is what happens in tolerance. So needing more of a substance to feel pleasure or experiencing less pleasure at a given dose is called tolerance. Next pathology. We do not get the drug, we have to give up that drug. Then a problem occurs which is known as withdrawal. Tolerance and withdrawal are very important thing we should know. What happens when a drug is not available or we stop that drug, it leads to withdrawal, which is miserable, which has miserable physical and mental symptoms. To illustrate, I will give you an example of a patient of my own village who used to drink daily, maybe 3-4 drinks. He developed viral upper respiratory infection. Nowadays that becomes prolonged and it leads to pneumonitis also. So he was suffering from that viral induced pneumonitis. So he had a lot of problems because of it. The relatives advised him to stop the drink. And he also thought that if I stop the drink, this respiratory problem may get all right. When he did that, on the 3rd day, he's from my village. He was brought to my home and he was in a miserable shape. He was tremulous like anything. He had a cup of water in his hand and would drink water. When I looked at his blood pressure, it was 180 by 120. Heart rate was 180. So this was all because of the withdrawal symptoms. Because he had stopped drinking alcohol, alcohol abuser has stopped drinking alcohol and then he was suffering from this withdrawal. So whenever we try to bring out an alcoholic from drug, it should be done under the supervision of a healthcare specialist, if possible by a psychiatrist. So barbiturates and alcohol withdrawals are very, very severe. Now, to cut things short, now we will say, what is the solution? This investigators have done a lot of work on this subject. Previously, it was very difficult to bring these addicts out of addiction. But many psychiatrists have tried it. What they advise is dopamine fasting. Dopamine fasting. Now we know that it is because of dopamine. So if I'm drinking quite a lot, or if I'm taking a drug, I will stop taking that drug. First 1 week, I'll feel miserable. All these symptoms will come of withdrawal. But if I resist it and go on for the second week, then things would have improved. I would feel better. My anxiety, my depression would have become half. Third week, I will be much better. Fourth week, in 1 month, I'll be much better. Those anxiety and depression will have considerably gone. That will give me a thought that now all those bad feelings that I was having was because of this thing, because of this dopamine. So we should try to do that. And at the same time, then they advise these subjects, these patients, to attend their group. Say if it is Alcoholic Anonymous, they're same people. They have a group where they discuss things very openly. They have a 12-step procedure. When they follow it, when we start going to that after dopamine fasting, gradually things would improve. But otherwise also, you see, then this experience will tell him or her that maybe I don't need this thing every day. Maybe I can do it once in 10 days, one in a fortnight. I'll control over it. So some inkling will go to that part. So I'm trying to wind up. I've simply tried to tell you the basic science of addiction. We'll not go into all those drugs and other things. So why it is important is that our population is suffering from all these kinds of addiction, and if we don't try to educate them, you see their lifespan will be very short. Very short. And there is here, before concluding, I must say that there's difference between pleasure and happiness. Pleasure is experienced by just one individual, one person. Happiness is shared by many people. Neurotransmitter also. In pleasure, dopamine is involved. In happiness, serotonin is involved. So this is the difference. So one must advise people to shut off all these things. Rich people can spend their money on welfare things and get happiness instead of pleasure. Who is doing that? Bill Gates is doing it. He is donating all his money to malaria projects, HIV/AIDS project, tuberculosis, etc. Ratan Tata was doing this thing, sharing his fortune for welfare programs. So thank you very much for your attention.
So I want to thank you, Dr. Allah, and if anyone have question, we still have 20 minutes, so you can ask your doubt.
I have two questions. Number one, I wonder, because we are talking about the dopamine and all those chemicals that impacts the brain systems and including depression and all these problems, So what is the causes which brings imbalances of those chemicals, number one. And my second question is, now we discussed about the tolerance and about the withdrawal, If we need to overcome the addictions, what could be your suggestions to stop the addiction immediately, or should we stop step by step? These are my two questions. Thank you.
One, as I said, that we should try to make a balance of pleasure and pain. It should not be allowed to tilt on one side. How can we do it? We can do it by, you see, slowly, gradually, you see, doing away with all the pleasurable activities and all the drugs which are releasing dopamine. As I said, that if dopamine becomes more, it leads to certain other conditions like Alzheimer's or Parkinson's and that thing. So we should be very careful. We should advise the community that it's all right, once in a while you can take pleasurable this thing, but never go to the extent that you will become servant to it, you will become addicted to it. That's why I think I will continue with your second question. In the second question, what I will say, there's nothing so, this thing that you can stop this addiction all of a sudden. That's not possible. Even the psychiatrists are not able to do that. That's why, you see, quoting the latest neuroscience development, I say dopamine fasting, if you do it gradually, if you tolerate it. See, I can give you an example of a young girl who would always take weed, smoke. Now her parents will have a problem with that, and there will always be a family problem there because of it. Now, when he consulted the psychiatrist, she was sent to the psychiatrist by the parents. When they asked, you see, psychiatrists try to collect data first, try to know what caused this thing. So she said, look, if I don't take these weed, I'm miserable. I'm suffering from anxiety. I will not be in a position to talk to you in this way. So in the morning, I take one type of cannabis, in the evening another type of cannabis, and sometimes I take weed, but this goes. Then the psychiatrist advised this young girl about this dopamine fasting. Initially, she said, no, I cannot do it. The psychiatrist said, can you do it for 2 days? She said, yes. Now, why can't you do it for 1 week? Just do it for 1 week. Dopamine fasting. She did for 1 week. And second week, third week, fourth week. By fourth week, all her anxiety, depression, and all those things had gone. She came back to the psychiatrist. Now I'm absolutely fine. Now I have no problem with my parents, no problem with my brothers and sisters, no problem in the school, nothing. So that gives her an indication that her anxiety and depression was because of this dopamine kind of things, not because of anything. Now, by 1 month, if he or she is not doing well, then the psychiatrist or the doctor would think, no, her anxiety is not because of this thing. She may have some co-condition, some mental condition, bipolar disease or other psychiatric condition. Then the psychiatrist will look for those things. So giving up is a gradual process. You cannot do it instantaneously, quickly. And doing this quickly is very dangerous, particularly in alcohol and barbiturates.
I have also 2 questions. One is regarding,
嗯
whenever there is an increase or decrease of those neurotransmitters, such as dopamine, serotonin, and other,
嗯
neurotransmitters, like dopamine or serotonin. I would like to know whether this affects the size of those limbic parts, such as amygdala or the hypothalamus or thalamus. And my second question is that recently in my clinical practice, I met a lady who works in a NGO where she works with a lot of autistic patients. And I asked her why there's number of autistic patients increasing every day, especially among children. And her answer was, yes, because we give mobile to them and the children get addicted and gradually they develop this autistic conditions. Do you agree to this remark, or do you think that there are other conditions related with the autistic development among children?
Now, autistic spectrum disorder and particularly ADHD, these are neurodevelopmental diseases. These have got hereditary components also, but your consultant has rightly said that nowadays, in the present context, we see more of the autistic problems, more of the ADHD people, and this is because of these lifestyle changes. Smartphone. That's why the best advice would be to never introduce smartphone until the child is 3 or 4 years old. You should never do that. And it's a problem for the pediatricians also. Now, say for example, ADHD, attention deficit hyperactive disorder. Any pediatrician is not supposed to diagnose ADHD before three years, because we all have seen that a small child, as I said, he or she is trying to learn things. He or she is very hyperactive in those three years. So if we are going to label those cases as hyperactive disorder, we are at the wrong track. So the school teachers and the school medical staff should be looking for all these neurodevelopmental things after the age of 3 years. So that would be advisable. So she's right. Now it's more prevalent because of these things. Smartphone and processed foods, all those things, is becoming a problem, yes. All the conditions are because of all the metabolic diseases, all the psychiatric diseases, all the mental diseases, or because of the lifestyle. Lifestyle in the sense that we take, you see, undesirable food. We become obese, fatty liver, and all those, the depositions of fats on the arteries, involving the kidneys, the eyes, the heart, and everything, all goes through a single pathway. That's what they think. So until now, we were giving less importance to neurological problems, but brain, you see, takes 60% of our energy, though it is smaller in size, maybe 1.5 kilo or so, but and it is the most active part. It is working all the time. This axons, the neuroterminals, all these things are very active, commanding every activity in our physical conditions. So we must pay attention to this, whether it's pediatric or adult or psychiatric and mental disease.